Respiratory rate. The respiration rate is the number of breaths a person takes per minute. Record the patient's respiratory rate while pretending to palpate the radial pulse, to avoid making the patient aware you are directly observing their breathing. Note any asymmetries in the expiratory and inspiratory phases of respiration. The expiratory phase is often prolonged in asthma exacerbations and in patients with COPD. Assess the patient's respiratory rate for 60 seconds to calculate the number of breaths per minute. Parameters that need to be included are its rate, depth of breathing, and pattern of breathing. The typical respiratory rate for a healthy adult at rest is 12 to 16 breaths per minute and is termed apnea. It varies according to age as shown in the table. A respiratory rate of fewer than 12 breaths per minute is referred to as bradypnea. It can be physiologic while the patient is sleeping. Other causes include alcohol consumption, cerebrovascular accidents, and opiate overdose. A respiratory rate of more than 20 breaths per minute is referred to as tachypnea. The causes of increased respiratory rate are as follows: acidosis, asthma, COPD, dehydration, fever, hyperventilation, infections, lung cancer, and an overdose of aspirin or amphetamines. Apnea is the cessation of breathing. During apnea, there is no movement of the muscles of inhalation, and the volume of the lungs initially remains unchanged. This signals a life-threatening situation in which the patient will quickly succumb unless rescue breathing is instituted immediately. Abdominothoracic breathing is seen in males because of the virtue of a long diaphragm. Males have a more horizontally oriented rib cage. Hence, there is inefficient action of intercostal muscles, leading to less prominent thoracic breathing. Thoraco-abdominal breathing is seen in females due to greater inclination of the rib cage compared to males. This causes the intercostal muscles to raise the ribs more effectively. Hyperpnea is increased volume with or without an increased rate of breathing. Blood gases are normal. It refers to breathing that is abnormally deep and appears labored. Exercise or physical activity is the most frequent cause for hyperpnea. Cheyne-Stokes is a pattern of crescendo-decrescendo respirations, followed by a period of apnea. Seen in both normal individuals at altitude and individuals with severe neurological or cardiac disease. Biorespiratory pattern is characterized by regular deep respirations interspersed with periods of apnea. It is caused by damage to the pons due to stroke, trauma, or uncal herniation. Ataxic breathing is one of varying tidal volumes and rates. Apneistic breathing results from injury to the upper pons by a stroke or trauma and carries a poor prognosis. It is characterized by regular deep inspirations with an inspiratory pause followed by inadequate expiration. Apneistic breathing can be temporarily induced by ketamine. Agonal breathing is characterized by slow, very shallow irregular respirations that result from anoxic brain injury. This will often progress to apnea, depending on the underlying cause. Air trapping is common in obstructive lung diseases, such as COPD, where there is increased airway resistance, and thus expiration is difficult and prolonged. Patients unable to expire in normal volume, and with the increased rate of respiration, air is trapped in the lungs. Cosmell respiratory pattern occurs due to increased tidal volume, with or without an increased respiratory rate. Cosmell respirations can be seen with any disorder that causes significant acidosis. Sighing is an involuntary inspiration that is 1.5 to 2 times greater than normal tidal volume. Sighing breathing is observed in subjects suffering from anxiety, with no observed organic pathology. Dyspnea is the subjective sensation of difficulty breathing, and can occur with an elevated, normal, or a decreased respiratory rate. A few common causes of dyspnea are anxiety disorders, asthma, pulmonary embolism, broken ribs, cor pulmonale, choking, collapsed lung, and heart attack. Orthopnea refers to difficulty in respiration occurring on lying horizontal, but gets better when the patient sits up or stands. Orthopnea is seen in heart failure, obesity, pulmonary edema, and chronic bronchitis. Platypnea means shortness of breath, that is worsened by standing or sitting and improves when lying supine. Causes include congenital heart defects such as patent foramina valley, atrial septal defect and pulmonary arteriovenous malformation, lung parenchymal diseases, and hepatopulmonary syndrome to name a few. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.